For years, I kept my biggest insecurity hidden from the world, and most of you had probably never known. You see what's wrong with this picture? Or this one? What about this one? Hidden. Today, I faced my biggest insecurity head on. Alright, okay, I'm done being serious. Y'all know I can't keep it up for long. I play too much. Let's jump back to April 2024. All right, y'all, look, the time is finally here. It's the moment I've been waiting for, well, a part of the process I've been waiting for a very long time. I am at Nip and Tuck Plastic Surgery. Yes, plastic surgery. Don't judge me. Maybe you'll find out later why I'm having to do this. But yeah, I'm here. I got a consultation today, and we'll see how it goes. They're gonna look at me, and yeah, so. Let's go.
I saw you came in 2021, correct?
Yeah.
You're gonna get a gynecomastia. Well, you were then looking at a gynecomastia liposuction of the abdomen flanks. Sound right?
Same thing.
Same thing?
Yeah.
I figured.
Yeah.
So I'm gonna have you change into these shorts for me, okay?
Okay.
And then I'm gonna have you put this
You
down
said
on,
shorts?
like a jacket.
The shorts.
Boxers. Shorts.
Oh, okay.
Yeah,
Okay.
you know.
Okay.
Probably something similar what you may have on.
Okay.
And then just cover up with this gown for me,
Okay.
and then I'll be back in. We just need to make sure all your health history is still up to date, accurate, and then Dr. Jones will probably similar stuff.
Okay.
But we'll see. All right.
All right. So can I put these on over my underwear?
No,
or
no.
do I
You
take everything off?
Yeah, you take every dress down,
Oh.
and then put your boxers on, and that's why I got the gown to cover up so you're modest.
Okay. All right. I appreciate it. You know I'm crazy. They know. If they don't know, they gonna know. Look at this stupid ass string. Who this for? Who this for? I got the whole mind together like, you know how old we be doing when they roll? I got to hold my shit together like that.
Oh, that's crazy.
I'm gonna just tell you like this. The whole shouldn't have to see me. I ain't never been naked on camera. I'm naked up under all this. Y'all don't understand. I got on paper drawers and I don't know if they backwards or frontwards. I don't know. I just got them on. If y'all see something, don't look. I'm busting up out of all this paper. I'm just busting out of it. I just feel it splitting. Let me stand up for a second. Okay, again. If y'all didn't get it the first time, the reason I'm here is because I need a breast reduction. I've had titties since I was 12. Do you know what it's like to be a 12-year-old boy with titties? You know, this is, it's just fucked up. So, I've been trying to get rid of them since then. What happened was, now don't think this is no new shit. This is not new. This is not, oh, I got a little money now and I don't know what to do with it, so I just can't get some surgery. No, it's not that. I've been trying to get this done since I was 12, but my insurance back then wouldn't pay for it because they said it wasn't big enough. So the doctor, he was like, oh, I just wear a sweater. We'll get back to that.
So let's make sure we got everything still looking good. So no past medical history,
Right.
like no hypertension, no diabetes, nothing
Right,
of that
right.
nature. Okay. And then you had an operation on your nose septum in 2007.
Oh, yeah.
And then did they put you under anesthesia for that?
Yes.
Okay. And then have you ever had like a negative side effect with anesthesia?
No.
Good. And then any history of keloids?
No.
And then no allergies that you're allergic to, not allergies, no medications that you're allergic to, no foods?
Right.
And any medications or vitamins you currently take?
Semaglutide. I'm on semaglutide right now.
You're on semaglutide, okay. And when did you start semaglutide?
October of last year.
Okay. And have you lost any weight on it?
Yeah.
Okay. How much?
Around 40 pounds.
And did you get to your goal, or you want to?
I'm close.
Okay.
Yeah, I got a couple more pounds I want gone. So.
All right. And you said you don't smoke. You currently drink, and says socially, frequently, occasionally.
Occasionally.
Okay.
Yeah. What was we talking about before she came here? Oh, the doctor. The doctor. I said, doctor. What he told me to put on a sweater. Okay, we'll go back to that.
Yeah.
Okay.
Go back to it.
So, continuing my story about what happened when I was 12. So when I was at the doctor, and they said they couldn't give me, I didn't get approved for the surgery because they weren't big enough. Which sounds crazy. I mean, they still there. The doctors said for me to just put on a sweater. Okay, great. So what do I do in the summertime? Then he said put on 2 t-shirts. So the doctor already knowing it's bad because he's telling me to double up on the shirts. But believe it or not, and in my mind, I'm not doing all of that. But over the years, I come to realize I did just that. Y'all, I have mastered what clothes to wear. Like, I love pullovers and hoodies, and because it helps, it hides. What else? I don't just do t-shirts. If I wear like a t-shirt, 9 times out of 10, I got a tank top on under that, especially when I was bigger. But now that I lost weight, I can kind of get away with wearing a t-shirt that kind of is a little big. I can't wear nothing tight. I'm not wearing nothing tight. I'm not wearing nothing silk. I can't do it. But give me some silk when I get rid of this milk. You understand me? When these leave, I'm silk. I want some silk all the way down. You ever seen them outfits where like the silk top and the silk pants, they have on nice shoes like all black?
Yeah.
Y'all ain't ready to tell me nothing.
Oh yeah.
So tell me what's going on. So you were in for a consultation before, right?
Yeah. But you remember, I don't know if you remember this, but it was 2 years ago. I came in here because, for the gynecomastia stuff,
right.
And I was supposed to be getting filmed for this TV show,
right.
That ultimately didn't happen because they was trying to get it picked up, and I was just like, okay, I just paused the surgery until y'all get it picked up. It never got picked up, I guess, but if it did, It didn't get picked up with me on it. I don't know. I just never heard nothing back. Like over time, the calls and stuff started like getting less and less, and then I would call them, and they were like, "Oh, no updates." So I'm like, okay, whatever. I just
never happened.
Yeah. So I'm like, I just do it myself. Yeah.
So let's just go over some things. Just remind me, what medical history? Any medical problems? Have you had any surgeries?
The only I had one was like 2007. It was something like I had something in my nose that I had to
sinus surgery.
Yeah, something like that. Yeah.
And no allergies and medications?
No, the only medication I'm taking right now is semaglutide.
Okay.
Yeah.
So you've been losing weight. Do you know what dose you're on?
I would have to ask.
How much weight have you lost?
About 40 pounds.
Okay, good. And you don't smoke? Okay. All right. Well, let me have you stand up. Let's just have a look. And tell me your main area of concern.
Do not scroll past this part. Listen, I just want to put y'all on something right quick. This is called Glow Melanin. This is what I have been using. A lot of people have said, I promise you, I'm not just making this up. People have told me that my skin have cleared up. I promise you, I went live on that. It's been in the comments and in my DM. They want to know how. Boom. This is what I'm telling y'all. I use turmeric soap every single time I get in the shower. Every time I shower, for instructional purposes, I use it outside the shower this time. I just put it on my face. I let it sit. Then I bathe my body. Then I, rinse my face. Then right here, I have a dark spot correcting serum that I just started using. So I'm going to see what they do for me. But I'm telling y'all, this has really it changed the game. I don't know what they got in this soap other than turmeric, but it's changing the game for me. I'm going to put some before and after pictures on here so y'all can see. I'm not lying. I have no reason to lie to y'all. Look at the before. Okay, now look at the after. Oh, okay. All right, then. Back to the video.
Here? Okay. All right. Let me have you take that off. So, you have gynecomastia, and basically what that means is you have breast tissue. So men develop it for all sorts of reasons. Most commonly it's idiopathic, meaning it just happens. And so basically it's a hormone imbalance, and we all, as a man, we all have some breast tissue, but you just have excess.
Yeah.
All right. So for you, you have some excess skin as well.
Mhm.
So sometimes I'm able to just do liposuction and skin tightening, and then it just kind of sticks down. For
Mhm.
you, it really depends on how you want to approach this. Because sometimes I have to make an incision right here, take out all the breast tissue, and kind of paste the nipple on. The downside of doing that way is you're gonna have a scar on your chest. The upside is your chest will be flatter.
Yeah.
If you just want to say, hey doc, I don't want that scar right there, basically I can make a little scar inside like your nipple relar junction, suction the crap out of it. And then I would use what we call a skin tightening device. It's called Renuvion. And basically it helps tighten your skin up. The downside is you have a significant amount of skin laxity, but how old are you?
26.
So you're really young. Your skin should contract. It's just a matter of, are you okay with having a scar on your chest? Or if we do it the other way, are you okay with the possibility of needing a revision?
With the scar, how long is the scar?
So it's gonna be like from here to probably about right here.
Okay.
So what I'm saying, that's what I'm saying. Like as a man, like you take off your shirt, everybody's gonna see the scar on your chest. I mean, you're a little hairy, but not like crazy.
Yeah.
So even with the hair, will it cover up the scar? Maybe, but not. It just depends on how you want to approach it. Then for your belly, you have a little bit of extra skin, but I mean, can you benefit from a tummy tuck? Yes, we make an incision down here and get rid of all this loose skin. But I would probably say the same thing about your belly. I would just lipo and then do the skin tightening.
Okay.
See where we land, and then as long term, if you need to have a tummy tuck, we can do one.
Okay.
But I just feel like once you have that scar is permanent. I mean, I'll be able to take this in, flatten this out, and then you have some stretch marks, which is a sign that your skin has been, your collagen has been disrupted. So typically I would recommend a tummy tuck, but you're kind of like borderline. Like if we did a tummy tuck, it would be more definitive, but you're gonna have a scar and your downtime would be a little bit longer. Turn around for me. So, and even back here, are you still losing weight?
Yeah, I am.
I would lipo your back too, and then do the skin tightening. Are you going to the gym?
Not yet. I haven't started yet.
You need to. You gotta get it.
I know. Yeah.
You can sit down. You can put that back on. So the reason you need to go to the gym is because with the weight loss medication you're on, you're losing muscle mass.
Yeah.
So you got to do some sort of strength training, or you're just gonna be like floppy.
Yeah.
You don't want to be 26.
Floppy.
Yeah. So the medication, the strength training will help with that. So in regards to your surgical options, either we can do the lipo with the skin tightening to everything, or you could you say, hey, you know what, I want the definitive plan, just cut it, and then you just be done with it. But I personally, what I would suggest for you is, I think you're kind of on a cusp. I think if we went in there and aggressively did the lipo, and then if I need to cut out some of the breast tissue, I just open that incision a little wider, and then take it out, and then do the skin tightening after.
Okay.
And then hopefully the skin tightening will get you to a place where you're like, you know what, doc,
Yeah. Okay. Yeah. I think that.
Okay.
At least I think I want to try that first.
Yeah.
You know.
Because if you do it the other way, I mean, it's permanent. Like, nothing I can do about it. And the downside of doing it the other way is I would have to take off your nipple and patch it on as a skin graft. And when we do that, we don't always save the nipple. Sometimes part of it's lost, sometimes all of it's lost. And so you have additional scar. So I think doing it this way gives you a little bit more options. I mean, you're 26, you can always do something else down the line if it's not to your satisfaction, but I think you'll be fine.
Okay. Yeah. Yeah.
Yeah.
I go with your recommendation.
And then so after the key compression, you have to wear this garment. It looks like a leotard to keep everything tight. You need to wear it for about 2 or 3 months.
Okay.
No strenuous exercise, no heavy lifting for about 4 or 5 weeks. So during that time, stay hydrated, control your diet, watch your diet, and then as soon as we're done, go to the gym. And then that's what's gonna make the biggest difference: the diet and the exercise.
Okay.
So if you commit to having surgery, I want you to start exercising now.
Okay.
And then with the weight loss medication, you have to stop it 2 weeks before surgery.
Okay.
The reason being is because it slows down your stomach, and so we don't want you to go into surgery like you stop eating the night before, and you still have gastric contents, food in your stomach. They put you to sleep. You can aspirate, and it goes into your lungs. And that'd be a bad situation.
Yeah. Okay.
So who will be taking care of you after?
I got a couple friends and my mom.
Okay. All right. Cool. Any questions? Based on the information I gave you, so your surgery would be done as an outpatient. Like you go home the same day. You need some assistance for the first few days, and I would say after like about 4 days or so, you should be good to go. But I wouldn't go back to work for maybe like about a week. Yeah, you'll be really sore. Take the pain medication as needed. The more you move around, the faster you'll recover.
Okay. When it comes to like massages and stuff, when would I schedule those? Like immediately?
Get them a day after surgery. Like within the first 24, 48 hours, we do the massages in the office. Purpose of the massage: help with your shape, help you recover faster, help with the swelling and the bruising.
Okay.
Yeah.
Okay, finally done. I'm tired. I'm sweating. I'm ready to go home and take a bath. I've been out all day. But yeah, I mean, today went good. I'm a little nervous, just a little bit. Well, not really, cause like I said, this is something I've been wanting to do for a long time. But all the people in there, they was really nice. Black doctor, he do good work. He do really good work. So that's why it's like, yeah, I feel like I chose the right place, chose the right doctor, all of that. So if you're watching this, if you made it to this point, I would ask if you like, comment, or subscribe. I don't ask y'all to do all 3 of those. Just choose one because there's a lot to do for free, but just do one for me. But yeah, I'll see y'all in the next video.